The first thing I suggest you do is if you're traveling outside of the United States, you should look up on the CDC website if the place you're going to has an outbreak or has cases of dengue. This will help you be more prepared. You know, dengue is it's a disease caused by a virus that's spread through mosquito bites. Operative word, mosquito bites. It can take up to 2 weeks to develop the illness. Symptoms include things like fever, headache, nausea, vomiting, rash, muscle and joint pains, and even minor bleeding. The thing about it is symptoms typically last 2 to 7 days. Most will recover after a week, but dengue can become severe, even within a few hours. And severe dengue really is a medical emergency, usually requiring hospitalization. And just so you know, like severe cases, we're talking about things like hemorrhaging, which means uncontrolled bleeding, shock, which means like a severely low blood pressure requiring life-saving medications, organ failure, even death. So you see how, yes, it may be mild or moderate for many people, but it can also be very severe. I know you're wondering, okay, well, how do you prevent getting dengue? Now, remember I said this is a disease, a virus that's transmitted through mosquitoes, okay? The biggest thing is preventing mosquito bites. First thing you want to do is use an EPA registered insect repellent. You can Google these. This is really important. For those of you who are watching on YouTube, I will put in the description of this video a link to EPA registered insect repellents. Wear long sleeve shirts and long pants when outdoors. Also sleep in an air conditioned room with window screens. You know, protect yourself against mosquitoes. This is very important.